Welcome back to the Wellness with Delaney podcast. Today I'm sitting down with Dr. Catherine Kennedy. I am so excited to chat with her because we have recently connected over her really cool, really unique, and really impactful product that can not only help you elevate your beauty, but your athletic function, your immune health, your sleep, and so much more. If you think this sounds too good to be true, let me tell you, you are in for a treat because it's so good, but it's not too good to be true. It's real. So, welcome, Dr. Catherine Kennedy. Thank you so much for joining.
Hi, Delaney. I'm so excited to do this with you today. So fun. This is a fun topic, a real positive topic for all of us.
I love it. Yeah, I love fun medicine, right? Like stuff that we can
Yes,
do that is just to take care of ourselves and feel amazing. So, can we just start with like the background? Like, how did you discover the importance of nasal breathing, of mouth strength, all this stuff?
absolutely. So, my background, I'm a board certified pathologist in both anatomic and clinical pathology. So, the bulk of my career has been in the hospital setting, right, where we see the sickest of the sick. I see the worst of the worst specimens that come through the pathology department. So, as I was getting a little bit older in age, I started having some of my own issues. I noticed I was starting to snore at night, and I'm a lifelong allergy sufferer. And so, as I hit midlife with estrogen loss, I started to notice these types of changes. And I, of course, know what the detriments are of snoring and going down a bad pathway of snoring and what that can potentially lead to in menopause, postmenopause, and beyond. I did not want to go down and be at risk for sleep apnea, obstructive sleep apnea. I don't want to be at risk for dysphagia, which oropharyngeal dysphagia is weak tongue. So a lot for me was the health component, but I also was noticing too this world called face yoga, where they were doing some of these types of strengthening exercises where they do it for the aesthetic benefit. And so I was kind of doing it for a little bit of both. I thought, okay, this makes a lot of good sense. And so that's what I was doing. But I was getting frustrated because I didn't feel I was progressing to where I wanted to be. And so I kind of thought to myself, there's something that I can do. I'm a tinkerer. I'm always playing with stuff. I always have ideas. I built these bookcases behind me. I'm always doing stuff like that. So I thought I can figure out a way to exercise and get to these muscles. You cute dog. And really strengthen them more efficiently. I want to work more efficiently. I want to feel like I'm getting the results. So I tried a few things. They didn't really work. I was working with balloons, with medical grade balloons, Delaney. And medical grade balloons we use in everything from interventional radiology to cardiology, orthopedic surgery. We have balloons that we put in every type of orifice in the body for some medical reason. And that wasn't working. So I had to kind of look further. And eventually I came across the triangular shape. And this is a game changer. So when I created these and started using these, I noticed this is working so well for me. I've stopped snoring. I have a closed mouth. I wake up with a moist mouth. I'm more rested. I perform better in the gym. And I feel like I'm looking a little bit better, more robust, a little more lifted. And so I thought, I'm going to bring these to market because they were working so well. I really wanted to share these with the marketplace. So that's kind of where it all started. So, and that's where
Amazing.
we are.
I love that it starts with your health
Mhm.
too. I think so many people like come up with these beautiful ideas and it starts with their health or the health of
Yeah.
somebody that they love dearly. Okay, so for people who don't even know, why is snoring particularly bad for you?
Right. So snoring brings on so many issues, right? When you have that open mouth position, you're not utilizing your nose, right? And we know the nose has a very important function in immunity. It filters the air, it warms the air, it humidifies the air. And probably most importantly, it releases nitric oxide, which helps us oxygenate better. So you're going to breathe deeper, use the deeper lower parts of the lungs. And when you mouth breathe, you don't have any of those benefits. There's nothing to filter out viruses, air particles, all of these other problems. Then you bring on the oral issues, right? You have xerostomia, which is dry mouth, which can lead to cavities and gum disease, periodontal disease, all these other health sequelae that we can avoid if we keep our muscles strong and we are aware of our tongue position and if we're nasally breathing or not. And so this is so important that people understand that. And we really want to catch it young. So in our younger children, we want to make sure that they're healthy and that they're well rested and they're breathing through their nose day
Mm.
and night, and they have that nice closed position. From the aesthetic end, right? If you have that open mouth position and you're breathing through the mouth, over time, your facial anatomy can and will change if you have years of mouth breathing. And if you look at some of the images, you'll notice some of the facial features that you'll see. More of a flattened face, more of the jaw will hang downward. And you'll see these types of changes. Some of the nose changes, you'll have more of a distinct, more of a hook type of nose. So you'll get some facial changes if you're mouth breathing for a very long period of time over the years. So it impacts your aesthetics and it impacts your health. And I think these are really important topics for people to start to really pay attention to. And your audience, who are future moms or maybe have young children now, can start to be on the lookout for these types of issues. So
Mhm.
it's, we just really want to try to let people know it's important to breathe through your nose and feel
Yeah.
well rested the next day. So
Yeah, absolutely. I mean, even I started using your beauty balloons about a week ago, and I'm definitely going to get into. I've seen already some really cool changes, but even before that, I've
good.
been working on nasal breathing while I sleep for the past year or so. I've started mouth taping, and I've noticed so many differences. It's crazy,
Yes, I
crazy.
know.
So I
I
know
know.
that some people think
Yeah.
mouth breathing is controversial, and I think this is kind of wild. I've heard people say it can be trigger for like
Mhm.
TMJ, like keeping your mouth shut can be trigger for TMJ, or that it's not safe, yada yada. What are your thoughts on like mouth taping?
Oh, mouth taping. Yes. Well, for me right now, I don't have to use mouth tape because I've been
Amazing.
able to strengthen my lip seal strength so much. And I've trained myself to know where my tongue is. And so, like I said, since I have allergies, I'm such at risk for converting back to a mouth breathing type of habit, and same with snoring. So I'm very always aware of where my tongue is, and I constantly have, and you'll see, I constantly have tissues. I have them with me all the time, and I have the nasal saline flush. So I'm constantly doing what we call nasal hygiene. But the open mouth position also can contribute to TMJ. We really want to keep that you want your jaw, you want to have a good range of motion of your jaw. So you want to have, your teeth don't have to necessarily touch, grinding, clenching. Some of these things can also be signs that someone is struggling with their airway as well at night. It isn't always stress. I mean, there's other reasons that folks can grind and have really a lot of tension in these mastication muscles, the masseter muscles. So that's something also that people can kind of pay attention to on themselves or their loved one if their teeth are getting worn down. So those are all issues that you can really pay attention to. And right now, what's really interesting too, Delaney, is our dentists screen for sleep related breathing disorders.
Hmm.
So that's another bonus to go to your dentist. You get free screening for if you might be suffering from a sleep related breathing disorder. Since they work in the oral cavity, this is something that they can be on the lookout for. And this is certainly something that you can talk to your dentist about too. And what are some things that we can do? And they've got lots of creative things that can help folks that might be suffering from these types of issues. So lots
Amazing.
of good stuff to know. I know.
Yeah, it's amazing how much stems from like our mouth and how we breathe, and it just has this cascade of effects on all levels of life. And I know another common thing that can affect our health and aesthetics is just like aging and how our muscles age in our faces. And I know
Absolutely.
that's something you're really passionate about and knowledgeable about. So, how do our faces change as we age before, menopause, perimenopause, and beyond?
Absolutely. And where we'll really start to see that is when estrogen starts to dip. That's what we would refer to as the perimenopausal phase of life. And it can happen as early as 35, 38. And so, it'll wax and wane. Even if your lab work will come back normal, it doesn't mean that some of the things that you might be feeling or noticing aren't really happening. So, anybody that thinks that they're in perimenopause or really want to get checked out for that too, they really need to find somebody who really specializes in that area as well to look at these types of changes. But for facial aging, everything that we talk about, Delaney, from below the clavicle is happening above the clavicle. Aging doesn't stop at the clavicle. And we'll talk about the musculoskeletal syndrome of menopause, where we have bone loss, muscles that weaken, decondition, atrophy. All of these types of changes are happening, and they're happening in our airway. They're happening all within the oral cavity. And we are having bone loss. We lose bone in the mandible. We lose bone around the eye sockets, bony loss there. And so these types of changes are happening. And so, like I said, I created a tool to help us keep our muscles as strong as we can in the head and neck region to help combat some of these facial aging changes and keep us healthy and strong and more vibrant, and feel rejuvenated with doing facial type of movements and exercise. No different than what we do for the body. We work so hard on our body to stay in shape, right? And our muscles strong and toned. The same concept up here. It's just a little bit newer of an idea for those that think, how the heck can you exercise your face? How the heck can you exercise your airway? And even when I first came into this preventative medicine, I consider this a preventative medicine is what I'm doing, a holistic type of functional type of work. At first for me too, but then the fact that I have suffered so much with lifetime allergies, my own oral changes. As in my youth, I had retraction orthodontics. Nowadays, we want to do protraction, where we want to grow the jaws forward in order to open up the airway. So if the jaws grow wide, broad, and flat is what the palate should be, we're going to open up that airway. And so that's a shift that we're seeing in our orthodontic world to help with that, because we're becoming really a world of small jaws with a lot of our the way that we eat, or lack of chewing, right? Hard chewing, and different types of other issues that are going on there. So, but with facial aging, we want to avoid the 3Ds: deflation, descent, and deterioration. Those are what we call the 3Ds of aging for facial aging. And so this is a way that we can try to, like I said, stave off the changes, try to do some preventative work, especially the earlier that you start to do these types of movements. Over time, they're going to help you. And so, and you're going to work on your health, and you want, it's going to help with your posture and everything else that we talk about for health. So you want to catch it early, and let's try to avoid the 3Ds as much as we can. And it's you just have to do it, right? It's part of, and I'd love to see this part of daily self-care. And I know we had kind of touched upon that. It doesn't take that long. I'll do mine. I'll even do mine in the car because I'm busy. And so I have to find time when I'm going to carve it out. And so I'll do some of these simple little moves for my tongue and for my lips and for my cheeks in the car. And that has worked really well for me. Or if I'm kind of on the computer, I do keep my tools with me at my desk as well. And it helps kind of give me a little bit of a pickup during the day too. So like I said, I do a little bit of this every day, and it's part of my head to toe fitness. And I think you've heard me say that head to toe fitness is really what we want to, what we want to do. It doesn't stop, it doesn't stop at the clavicle.
Yeah, no, I love that because I think we're getting more knowledgeable about how important it is for women to lift weights as they age and keep that muscle mass on. And our faces are part of our bodies. We have muscles in our face.
Absolutely.
So it's intuitive that it would be the same. And I have to say, like, quick testimonial, I started using beauty balloons about a week ago. Honestly, like 6 days ago, I think. And I DM'd you and I was like, I don't know. It feels too soon to be seeing results. But one thing I've noticed is my lips already look plumper. Like, I feel like it looks like I got a little bit of filler, which I've never had filler before. But within about 3 days, I was like, whoa. And I did it in the car. And I was driving in the car with Taylor. So I was just kind of passenger princessing, doing my exercises. I went through your whole booklet because I had a 3-hour car ride. I was just practicing. And I showed him my lips before and after. And he was like, whoa, like your lips look huge in a good way. And then something else, I mean, I've definitely am starting to notice a little bit more definition in my cheeks, but something else I've noticed, and I actually have been dying to ask you, but I decided to hold it for this podcast because I really
Sure.
wanted other people to hear this as well. So I've noticed like hyperpigmentation and texture where I from years ago when I had an IUD before I learned a lot more about birth control and decided to
Yeah.
not go that route, it caused a lot of like breakouts. And so I still just have a little bit of like hyperpigmentation from that. And I've noticed in the past week, it's going down so much. And I was looking it up, like maybe it's the circulation boosting in my face, causing more healing. Is that something that like I know I do a lot. So I'm always trying to figure out what's coming from what, right? What I can allocate to what part of my routine. Do you think that beauty balloons can help with something like acne and acne scarring?
Well, that's interesting. I haven't, obviously to do those types of real deep dive into it. Obviously I'd love to be able to do some type of research, but with the increased blood flow, it certainly is possible because you're flushing out toxins, right? Just like the body. Whenever you use your muscles, obviously you bring in more of the good stuff, right? All the healing cells and everything that comes in with the circulation. And with lymph, you're moving the lymph. And this is key. This is the function of skeletal muscle. Every time you contract skeletal muscles, it pushes on your lymphatic channels. So you're moving that stagnant lymph through the system. And so all the bad stuff gets thrown out, if you will, into the lymph system. And so when you contract the muscles, that's a great thing. You're moving it out and you'll get that little bit of glow, right? It's just like a workout. If you get that nice flush. And so it is certainly possible. I feel like my skin looks better just as an anecdotal uh, experience with it. And one of the other things I think that for me personally, what I have noticed is I feel like I have more balance and more symmetry to my lips. And I don't have as dry a lips as I used to. I don't have the chapped lips. And I like the way that my lipstick goes on. And that's a nice anecdotal. I didn't really anticipate that. I definitely knew we're going to be able to bring back symmetry, balance, more harmony to the face, just like the body, right? If you're out of whack or you're out of balance, you want to work on the muscle, the weaker side, build up the weaker side, make it stronger to help bring back symmetry. And we know if you look to Delaney, about if you look at our rehab, our incredible therapists that work in the rehab space, the therapy space that bring back folks that have some type of paralysis, we know you're able to bring back that beautiful function and symmetry and balance. So that's what we're doing. Even though we may not have a true condition, we don't have a true paralysis, we're still able to bring back more harmony. And that's what
Mm-hmm.
you want. Because as we age, what happens is you get disharmony. You get what is called dynamic muscle discord, in particular, the perioral region, especially women. This is such a hard area for our dermatologists and our plastic surgeons to rejuvenate. And it's very difficult. It can be a challenging area because there's so much movement in this area. So you want to avoid dynamic muscle discord, and you don't want uh, downward pulling muscles being able to work harder than your lifting muscles. It's always a balance, right? So you really want to work on the lifting muscles and get those to be as toned as you can, more like they were in your youthful state. So it's always
Mm-hmm.
a tug of war. It's always, same thing with the body. You want to lift your triceps, so your arms, so you have toner arms, toner abs. It's no different from above the clavicle. We just have to learn how to engage some of these muscles. And we can do some of these funny moves. And that's why I made it so bright and fun, because we do feel silly. We do feel silly sticking our tongue out or making funny faces, as we're engaging the muscles. It's just a quirky anatomy up here to try to get to the tongue. And the tongue is really the most important. The tongue really can dictate facial structure and how your cheeks develop as you grow. And so you want to keep that tongue nice and strong and up on that palate so you can avoid that involution. You don't want to lose any more bone than you're already normally going to with the normal aging process. So it's just it's a fascinating topic. This is just such I love this topic because it impacts both your health, right? Me coming with my background from medicine, so many aspects in health. And then I love it from the aesthetic point of view. I love that because everybody wants to have their best face put forward when you meet new people. And we live in this world of media. Everybody's on the screen. And, so you want to try to, we're not trying, for me, we're all not trying to be 25 or 20, but you want to try to have as best presentation as you can. And so,
Absolutely. Yeah, and I love it because you can start these things at any age, but my goal with sharing a lot of this information in my 20s is I know that when a lot of people find holistic remedies for health and beauty, their biggest complaint is that they didn't find it sooner. I hear that from my mom a lot. She's always
Yeah.
like, I wish I had started this in my 20s. Like when we talk about Frowny, she's like, I wish I started this in my 20s. You're so lucky. And I know she'll probably say the same thing about beauty balloons since she has them now. And I'm like, okay, so I hear this feedback. I'm in my 20s. A lot of my audience is in their 20s. Let's get these girls started on these things young so that they don't feel like, because there's always this tension rod of like,
Yes.
do I want to just age how I age, or do I want to go like the plastic surgery, injectables route? And it's like you're choosing between these things when there's another option. There's an option of just prioritizing healthy aging and doing so many things that can actually be more impactful than people realize they are. Like I don't think people realize how impactful some of these natural solutions can be. And that's my goal, is to help people realize there is a natural way to still feel their best, but not go that route and just do things that support their body, because really, I mean, our beauty is indicator of our health, right? A healthy face is a beautiful face. So we can do these things naturally. So with tongue health, you mentioned tongue health is so important. And I don't know if people even realize this. So how can beauty balloons help your tongue placement and strength? And like, what is the importance of tongue placement?
Yes. So absolutely. So the tongue, we know, is voluntary skeletal muscle. And it's a quirky, it's a quirky organ. And we don't really think about our tongue. I haven't I haven't really thought about my tongue until I'm in my 50s. And like I said, I'm learning more about this. And I have someone in my family that also has a cleft lip, cleft palate. So I really understand this issue of tongue placement and bony growth and all the health, like I said, the health, behavioral issues, things like this that can come with not breathing through your nose. And it's a fascinating topic. But the tongue, what the proper resting position or tongue posture, if you want to call it, will have the tip of the tongue right behind the upper teeth. So right where the gum, you can feel it with the tip of your tongue. And you really want the entire body of the tongue and the posterior part of the tongue all up on the palate as best as you can. Now, those of us that have short palates or narrow or vaulted palates, that's a challenge. And what you can see, Delaney, sometimes is scalloped tongue. And what that is on the lateral edges, on the edges of the tongue, you'll get the teeth imprints. So if someone sticks their tongue out, you can see a little bit of scalloping on the tongue. That's because there isn't enough space for the tongue to actually fit up on the palate. And that's a sign that the palate is too narrow. And so we want to nip this very young. We want, that's as early as 3, 4, 5, 6, 7. We want to watch these young kids. Now, those of us that are full grown, I can't really change my bones unless I do the bony palatal expansion that I am considering to get more breathing capacity, to open up my nasal cavity. So I will have a larger nasal cavity and be able to breathe easier on top of my chronically inflamed mucosa up there. My turbinates within my nose are chronically inflamed. And that's just what I've lived with my whole life. So the tongue is very important. And even if you have a challenge fitting the tongue up there, you want to still try. You want to really try, and you can slow down your breath so you can breathe deeper. And it's just a matter of making these adjustments over time. And you can work with a professional too, speech and language pathologist or some of the myofunctional therapists. If you have one in your area, these types of therapy, it's good because they can really teach you. And we're doing that with my family member as well. So they can really help guide you as to what you can do to make these little changes. They're little changes over time, but that tongue is so important, and boy, do we take it for granted. And the having that support the tongue to help that palate stay wide, broad, flat, and not collapse over time. And that's part of the dissension, right? If you have the bony loss and all your tissues will kind of descend, and then they will kind of end up, you'll have more jowling, a little more heaviness down by the lower face. And so part of the facial exercise that I'd love to see folks do is to help keep the weight of the face in the upper face. And I call it the triangle of youth. And so oddly enough, that the tool ended up being a triangle. So you want to keep, high cheeks, full cheeks, and a defined jawline. And those are the three facial features that actually define the triangle of youth. And that's the whole gold standard in aesthetic medicine. So that's what my colleagues in dermatology and plastic surgery, that's their goal. They want to keep the weight of the face north, if you will, right? Up high. And so that's the triangle of youth. And so that's what they'll do with some of their procedures. But the reality is most people really can't, number one, afford or have the downtime of formal big plastic surgery. Very, very small percentage of people will actually truly undergo a true facelift in reality. So then we're stuck with, okay, well, what else can we do? What else, like you said, what else is out there? Well, there's so many great skin products, right? We do the sunscreen, we do our diet, right? We do our healthy, balanced diet, we eat our protein, and now they want us eating, 1 gram of protein per body weight. So if you weigh 120 pounds, try to eat 120 grams of protein a day. It's a challenge, but we want to try to do that. So obviously nutrition, and everybody talks about nutrition, and that's a challenge for all of us. I know I struggle with it on a daily basis. Getting my fiber and everything else. That's just it's a hard, it's a hard challenge in our society. You go to a restaurant and what am I going to order off this menu that's healthy and is the appropriate portion size? So it's a challenge for all of us. There's a lot of great products out there. I love your products that you've done, and we can play around with some of those fun things. But there's a lot of great, like you said, some natural facial massage tools, which is fantastic to relax the muscles, just like you get a body massage. It's the same. It's the same type of concept, and you can do it for yourself and try, and you're not spending as much. I mean, a lot of the obstacles too is frankly is cost. To do a lot of these procedures is very, very costly, and to keep up with it is challenging, for those that may dabble. But you can do both, right? You can always, what I found too with my tools, I think if once you kind of start using them, I think that those that want to dabble in some of those, I think you'll find over time, you might be able to dial it back. So if you're trying to wean yourself off or dial it back or use a little less or save a little bit of money, I think as you do your facial exercise, you'll be able to dial back perhaps some of those other things that you maybe have gone down the rabbit hole with and want to try to back it out. So that's another nice advantage of doing facial exercise as well. But they are synergistic, they're complementary. And the good thing about this is we're targeting the muscle with what I've created, right? This is all about targeting skeletal muscle and building strong tone muscles. When you look at the dermatologist for procedures like the fillers, they inject either, Delaney, in the deep dermis, which is part of the skin. The skin has two layers, the epidermis and the dermis. They'll inject into the deep dermis, the subcutaneous tissue, or they'll actually inject along the bone. And when they hit the bone, the purpose is to bring back overall shape, right? Shape, and they want to sculpt and contour the face into that more youthful triangular shape. So that's what they're doing. The more defined the jawline, they'll put a lot of fillers along the jawline to get the definition. And then they can inject up here in the temple area. As we age, we'll get a little bit of that temporal wasting up there. So it's all about sculpting, contouring, shaping, and maintaining the triangle of youth is the aesthetic goal. So by adding in facial muscle exercise and some of these other really great tools that you're talking about are wonderful to use. They're all great. They're all great. I use some of them myself. Some of the massage techniques and things like this are all great to use.
Amazing. Yeah. Okay. So, and I think this is like shocking to a lot of people. I think a lot of people don't actually realize that face fitness is really a thing, or they don't realize it's effective. There are some like face yoga things on Instagram that are pretty popular, but I think a lot of people think it's a pseudoscience. So this is really exciting to have a doctor explaining why it is important, not just for beauty, but for health, but like marrying those two. So can you talk me through some of your favorite exercises with your tools for your tongue specifically?
Yes. And so what I did is for the facial exercise tools, I created the booklet. And within the booklet, there's close to 30 different exercises, which of course you don't have to do all 30. And believe me, there's even more that I couldn't fit in the book, because if I did, this would turn into a textbook. Yeah. So I said, I have to cut it off somewhere. And so the tongue chapter has many, many different exercises. I love doing the 2-step exercise. And again, the whole concept, Delaney, is to use resistance training. That's the whole concept. It's very simple. It's not anything that's complex. It's just the anatomy up here is a little quirky to work with. But we are adding resistance to skeletal muscle. And we know when we add resistance to any type of skeletal muscle, it's going to respond better. That's the whole basis for weight training. If you want to build muscle and you want to contour and you want to shape your body, you have to pick up weight. You have to use resistance. And so that is the whole premise of what I've done. And so with the tongue, you can do the butterfly tool opens in this way and this direction, the horizontal direction, the vertical direction. You can use it collapsed and it twists. So we take advantage of every different type of movement. And so the 2-step where you put your tongue in one hole, tool goes one way, tongue goes opposite. So everything is opposite the direction of the tongue. The push-pull, where you push the tongue onto the attachment site and you pull the tool back. I'll see people use spoons and things like that, but this gives you that extra spring to do that particular motion. And it's one tool that you can knock out in and around all of these different muscles. Very quick, very efficient. And I think you've heard me say, I like to refer to this as my TRX strap.
Yeah.
My band. This is my band. I can knock out all these exercises very efficiently, and I can get on with the day. And I can do what I need to do. And so, I can do a few minutes here, a few minutes there. But I do try to do something just about every day. I do try to do a little bit. Like I said, they're so easy to take around, and I created a storage purse that you can carry around. But I love the 2-step. I love the slingshot, I call it, the trampoline for that. And I love the tongue row. Anybody that's snoring,
love that.
Definitely the tongue row is your exercise, where you put the tool in the vertical plane, and then you hook your tongue around it and you can pull it back. And I'm just going to show, because this will be seen, right? Do we have a visual?
Yeah.
So I'm going to show, because I can't talk. And so I'll just do this. This is the tongue row. And I call it the row because it's like a row motion. You grab it and you kind of row it. I do a lot of rowing at the gym where I go to. And so I was thinking this is like a row type of motion. And then my kids help me name some of the other funny exercises. So I'll just show you this.
Yeah, I'll talk through it. So she has her tongue in one end and is holding the other on her chin, and she's like rowing the tip of her tongue back towards her uvula. To me, it reminds me a lot of like a bicep curl, that same kind of back and forth motion. This is actually my favorite of the tongue exercises, because it makes sense if you're already fitness minded. If you've ever rowed or curled something, it's that exact same motion, but with your tongue. And what you can see is underneath, like that under where someone might have a double chin is snatching up with it. So then also one thing that I know that you talk about, Dr. Katie, a lot is
Okay.
it snatches the jaw. So if you are somebody who struggles with that double
Mhm.
chin or flab under your jaw, this is going to help you get that gorgeous defined jawline that you've always wanted.
Mhm.
And I love that.
Yes, it'll help tone. Absolutely. When you move the jaw, you move the tongue really is so responsible for a lot of this tissue underneath here. And then this is another great one that I love. I call this the reverse plank. And this is the double chin one. This gets the floor of the mouth muscles. It's kind of like a hammock of muscles, if you will, that go from one ramus of the mandible. This is the part that we refer to as the ramus of the mandible. It's like a hammock, if you will, like a sling. And so that sags over time. It's inevitable, particularly, like I said, for women when we hit menopause. These are where these changes, and if you're snoring, that is going to really bring that be a problem for you.
Mm-hmm.
So this, I put the apex behind the lower teeth, and then I like this because you have to have a good range of motion of your temporal mandibular joint, so the jaws are open nice and wide. Then you have to control it with the tongue, and it's very difficult. And a lot of these moves, like I said, are done already in the world of rehab to help bring it back. But I added a tool to add resistance, so it works quicker, faster, more efficient, and you can feel it. uh,
Amazing. So she's using her tongue to pull that tool back and forward, and it is pretty crazy. I'll make sure to post this visual on social media because you can just see that snatch immediately. That's what's really crazy. That I feel like after a week, I'm already starting to see more snatch, more defined. And I don't even have like a double chin. So I'm
Right.
imagining like for somebody
Yeah.
who is struggling with that, how
Mhm.
quickly they're going to see results with some muscle being built right there.
And I'll just show you this one too. I like this
Yeah.
because when you take the butterfly, like I said, you can twist it. There's so many great ways. And by the way, I did get the patent, so I was very excited about that too. So this is very unique. And I love this because there's no batteries. There's
Hmm.
no batteries. You don't have to plug it in. This is safe on your teeth. This is safe in and around your oral cavity. This is food and contact safe, soft, squishy silicone. Just same similar material that you would see used for infant pacifiers. So very safe. So so I love, like I said, I did the tongue row, and we did the tongue reverse plank. And now I'm going to show you the jetting the jaw forward. And so this is another great one. I probably do this one too, just about every day. I just take this and I twist it. And then there's 4 contact points that I can lightly grip with my teeth. And so I just do the jaw forward. Then I'm going to put my head back, and I'm going to stretch that platysma muscle and my scalenes to help the neck, Delaney. If I would really love for people to do this just about every day. And I'm really starting to do this myself morning, and I'm trying to do it at night, brush my teeth and give myself this opportunity to really try to stretch out the scalene muscles, because we're all head down, that forward head tilt. We all are suffering from poor posture because of
Hmm.
that. And oh, we just, we all work from our phones. And so we're all head down. So this is this one. And then like this.
Amazing. Yeah, you can literally see all the muscles in the neck tightening.
You can do this inside. Mm-hmm.
Amazing.
Mm-hmm. And then same. And what I would always encourage too, you always want to do this in the mirror first so you know your form. And I probably should have said that earlier. Shoulders are down, and we never squint our eyes, and we don't need to lift our forehead when we do the exercises. So form is always really important. So at first
Hmm.
you can really practice in the mirror before then taking it on to wherever else you may want to try to do the exercises, not being in front of a mirror. But so those are great. And then of course, moving the jaw side to side. Get this over here.
Amazing. So we're really strengthening that kind of around the temples here, which
Mhm.
is going to help keep those muscles nice and robust to
Mhm.
prevent deterioration.
And we keep the range of the jaw, right? We want to keep that
Hmm.
good range of motion. It's kind of like we want to keep the range of motion on our hips, on
Hmm.
our arms. I can still get down on the floor, and I'm pretty flexible. Now, I don't do
Good.
my splits, but when I was little, I could do splits in all three, right?
Yeah.
The splits, doing all the gymnastics and everything in my youth. But it's the same concept here. You want to maintain your range of motion of your temporomandibular joint so you don't have issues down the road. So, if you're doing these types of exercises early on, you shouldn't have these types of issues. I mean, or you certainly wouldn't have it where it would be very debilitating and very, very problematic for some people, that it can be very painful. But range of motion is important to keep, and that's part of doing the exercises, keeping all this area strong, tone, lifted as much as you can. We know it's not plastic surgery. We know that, but we'll take what we can get. We certainly will take what we can get, and we'll take the health benefits
Exactly.
with it that come with doing these types of exercises. So there's so many great exercises. I love just the plain old hurdle. I love this one. My daughter was on the track team, and this is where the name hurdle came from. So the tongue goes up and over and through the triangle. And what I like about this, it trains the tongue to go straight. And so you shouldn't have a deviating tongue. Everybody should be able to stick their tongue out straight, should be able to go straight. But I like this for strengthening. You have to push it out, retract, push it out, and you get some resistance when you go through the triangle.
Amazing. And as she does this, if you're listening to the audio, I highly recommend, when you can, checking this out on YouTube. But regardless, we will start doing some live demonstrations on Instagram that will also get posted. So if you want to learn how to do these exercises for yourself, quick plug, check us out on Instagram. We'll be doing that together. So you mentioned early on how it's important, like early interventions. And even earlier, you mentioned how important it is for us to be looking at like infant breathing. So if let's say you have a baby or a small child that you're starting to realize is like mouth breathing, like what do you even do as an intervention?
That's right. And so some of the, and some people might say, oh, they'll grow out of it. Well, you are your best child's advocate.
Yeah.
And so you really, number one, education and awareness. You want to first be aware of these types of issues so that you can keep your eyes on your little ones. And then you want to seek out in your area someone that is airway focused or functional focused. But usually they'll say airway focused dentistry or airway focused orthodontics. So those are people that you can really try to seek out. And they may recommend a sleep study. So be prepared for something like that too. Depending on what you're seeing and what you can report to your healthcare provider. But you definitely want to be on the lookout for that. Late bedwetting is also kind of another issue in children too. If they're bedwetting to a later age, these are the types of behavioral issues. And you'll hear a lot of these airway focused healthcare providers talk about Delaney too. Some of the children that might be diagnosed with ADHD, really would be great to really look and observe how they're sleeping. Are they mouth breathing? These are types of behavioral changes that you could see. So before somebody gets labeled as ADHD, you really want to evaluate how is their sleep? Because I know I'm moody, cranky, horrible behavior if I'm not sleeping well, right? We all are. So imagine doing that over time. And if you're gasping for air at night, we call it apnea, where you'll skip a breath. And so you'll awaken yourself and you won't remember that the next day. So if you're suffering like this, you won't really know it until you get a real formal sleep study. And like I said, we went through this with my family member with the sleep study and all this information. So it's really important, like I said, education and awareness. And so we're talking about it, and working with my tool ties in on the whole sleep snoring issues, which I love. And then of course, ties in, like I said, it affects the whole thing, right? It's aesthetics, it's health across all of it. Those that have true facial paralysis for so many different conditions too. If your grandmother, mother, relative, neighbor, somebody like that has had a stroke, up to 80-90% of folks that have had a stroke can end up having post-stroke obstructive sleep apnea, which is devastating, right? That's a very, very Stroke can be so debilitating. And then you've got multiple sclerosis, of course, that can have oral issues, all your neurodegenerative disorders, Parkinson's, Alzheimer's, so many different conditions, Bell's palsy. So simple tool like this can really help with bringing back that symmetry, balance, and harmony. And so it spans everything, which of course it would. This is where it starts. And it's funny, Delaney, because I come back to my basic fundamental medical training, the ABCs of medicine. What are the ABCs of medicine? Airway, breathing, circulation. Airway, 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 breathing, right? Your top two of airway, breathing, circulation. It's so basic, but sometimes we get so bogged down in minutia and kind of overlook, how is this person breathing? We just kind of take that for granted, and you'll perform athletically better. Like, for example, I breathe through my nose when I work out. When I'm on the treadmill, I inhale and I exhale breathing, and I'm very aware of it. I make sure my nose is really clear before going to the gym. And so I've really worked on that. And I used to be where I would run in my 20s. I would breathe in and out through my mouth. I'd inhale, exhale through my mouth when I would run. And so
Wow.
when I used to run in my 20s, and boy, oh boy, don't I wish I knew what I know now, right? I would have completely, changed some things about what I was doing back then. But I lived my life off that antihistamines, the over-the-counter Claritins and the Flonaces, and and really, for me, the nasal saline flushes helped me with my allergies. Now, but like I said, I love this area because it spans every facet of health, and it spans aesthetics, because so much of the work in the plastic surgery and the dermatology world, they're masking a lot of these facial, or bony the bony lack of development, bony deficiencies. And so, if you don't have big full grown jaws, which means your zygomatic arch, which is part of the facial growth and a forward face, plastic surgery and some of the sculpting that they do with the fillers and some of the other creative artwork that they're able to do help kind of mask some of these shape and contour deficiencies from a lot of this issue that we're talking about, which is interesting.
It is
Really, really
interesting.
fascinating. And
Yeah.
it's artwork. Really, I sometimes I think of the plastic surgeon as an artist. You really, with some of what they can do in terms of bringing back contours and shape and definition. It's really interesting. The whole
Yeah.
topic.
It really is interesting. And like you said, it's kind of masking some of the different things that happen in our development. And I love that now there are options for us to be able to develop those out and have those muscles, because of course the thing that's going to be the most attractive is the thing that is the most healthy. Like biologically, that makes sense. If it's
Absolutely.
healthiest to have robust muscles in our faces, that's going to biologically be the most attractive thing, because we're designed to reproduce. And so
That's
we're
right.
naturally going to be like drawn to the healthiest, strongest, most biologically like elite version, right? And so it makes
Right,
sense.
right. And you're in right vibrancy. And
Yeah.
that's what we're talking about, to project your best vibrancy, to have uh a robust appearance from the clavicle and up. And because we're already doing those things for the body below the
Mhm.
clavicle. And of course, I always say the clavicle because that's where we define the head and neck region. But we have so many creative ways that we work out the body. I mean, it's unlimited, between the yoga blocks, the rubber bands. Like I said, the TRX strap, I think is one of my favorites, just because, like I said, I can do so much quick and fast, upper body, lower body, knock it out, turn around. It's fast, fast, fast. I'm not switching in and out of weights. And
Mhm.
that's what I really wanted with the beauty balloon, something that we could work efficiently
Yeah.
and manipulate it fast in and out and around the oral cavity, engage these muscles. So like I said, I love all that. I love all the different, I love tools, right? I love
Yeah.
tools. I love tools help us perform tasks better.
Yeah.
Right. And so the more tools that we have to help us, the more things we can achieve.
Mm-hmm.
right? And so that's the way I kind of look at all the different health equipment that we have for the body, which is endless. Some of the interesting creations, interesting designs that people have made. And I'd love to see more for the head and neck region,
Yeah.
something that's not invasive,
Mm-hmm.
something like you said, that's using what we have, right? Using our own muscles, using our own gut, right? And gut
Mm-hmm.
health is a big thing, right? With nutrition, we know that nutrition reflects on our skin. Good nutrition helps us tame acne, helps us keep inflammation down, which a lot of these inflammatory conditions show up on our face and in our body. So gut health is important, and part of gut health is keeping a closed mouth so we don't alter that microbiome. That's another bad thing about having the open mouth position. We want a closed mouth so we don't alter the oral microbiome, the gut microbiome, by mouth breathing. And
Mm-hmm.
we're seeing that that does change that as well. So we want to keep our good bacteria healthy,
Yes,
healthy, and not let the bad bacteria overtake the good bacteria. Just like we don't
absolutely.
want the downward pulling muscles overtaking the lifting muscles in the head and
Mm-hmm.
neck region and in the body, right? We want to maintain a healthy equilibrium. It's all about equilibrium and maintaining harmony inside the body, down to the cellular level, and exterior as well, right? Harmony, trying to have harmony in and out. In and
Absolutely.
out.
It's that inside out glow. Okay, so really
Yeah.
fast, I'm curious. I know you talk about this, and when we met to kind of go over some of the exercises, you mentioned this posture.
Mhm.
Why is posture important for aesthetics and health, especially as you are exercising?
Well, posture is so important, right? Posture clearly, well, for obviously for the body, we want to prevent injury, right? You want to, I mean, obviously when you're engaging in these things, but for posture, for the forward head tilt just is horrible for your neck. You're bringing all your tissues forward, all of that tech neck lines, right? The whole problem with the whole forward neck. So if you think of our military, I kind of think of the military sometime on how they stand, right? They have such a, the way they stand with their head is in line with their shoulders down. They have a very defined jawline. A lot of the time you can think of that if they have on their headgear and things like this. So I kind of have that in my mind when I think of posture. I think they exemplify what is the epitome of great posture. And that's what we all want to work toward rather than being slouched over. But it does help your aesthetics. It makes you look taller. Again, you're more in harmony when you're standing appropriately and when you're sitting appropriately. And you can think of the royals, right? You can think of the way, you know, some of the royals, their posture, right? You can think of that. I mean, that's just something that you look at, right? Well, if you look at the way they stand, they certainly are not slouched over. They certainly aren't head down in a phone. Have you ever seen Princess Kate photographed with her head down in the
Mhm.
phone? Never.
Yeah.
You'll never see that. And so those are kind of some fun things. But posture just gives that appearance of, again, harmony, overall
Mhm.
harmony, and projecting strong strength and health,
Yeah.
you know.
Yeah, I think it projects confidence too. There's a
Mhm,
level like if you see someone when I see
mhm,
a female who's hunched over, and she could be the most confident person in the world, but she might not appear that way, and a male too, actually. But when I see
mhm.
someone who's
Yeah.
standing tall, like eyes forward, shoulders back, it kind of like it speaks power, it speaks confidence, self-assuredness, and I think it's a really
Yeah.
attractive trait to have.
I do too, and it's welcoming. It's
Yeah.
welcoming, and they're approachable, and so just more social,
Yeah.
um, more trustworthy, maybe too. I guess you could even think of that too, Delaney.
Mhm.
But yeah, posture, and boy, like I said, I'm just as guilty because I've got my phone. Uh, I wish there was a way that somehow they could create something that props up where our phone, where we're looking more upward, but we're not there. But I know it's a daily battle for all of us. It's a
Mhm.
daily battle to try to have uh, not give in to that forward head down during work, or you're working on the computer and you're typing on the computer. Some of the flat screens will raise, which
Mhm.
does help. You can get some of those to lift so you're more in alignment. Um, so your ergonomics as you sit, your ergonomics are better. I know for me, like spending so many years at the microscope, I had to really watch my ergonomics, as you're sitting there. You really have to be careful. Otherwise you can fall into the forward shoulders rather than back. And when you do that too, you're compromising your ability to breathe deeply. When you have your shoulders back, breathing through the nose, again, you're breathing deeper, that you're allowing that diaphragm to descend, and you're
Mhm.
engaging those lower areas of the lung, and you're oxygenating better. And anytime you can improve your oxygenation to your tissues, you're just going to feel better. You're going to
Yeah.
look better. You're going to function better. Your brain is going to be sharper, the whole thing. So you really want to really just pay attention to what you're doing.
Absolutely. Yeah. Okay,
I know.
so one thing I love to ask everyone, I think it is the best question to find out from the experts. What are your health goals, or like what's your biggest health goal right now, and what are you doing to tackle it?
Yes, that's a beautiful question, and
Thank you.
that is exactly why I created this, Delaney. I mean, I joke, and I've heard some other healthcare providers will use this same similar expression. This is my nursing home prevention. This is,
Yeah.
I want to live the best quality of life that I can at this age, right? And I'm getting up there in years. And as I progress, because the average age that people are living to now is 81. So, am I living to 90? Am I living to 95? I want to be able to walk. I want to be able to run. I want to be able to move. I want to be able to get in and out of the tub. I want to be able to put my shoes on. So, all of these things that I'm doing are to enjoy life, be able to have the physical ability to do fun things, fun, exciting things that I've done my whole life. I've been, pretty active my whole life. And so, this is part of that head to toe fitness that I keep talking about. Head to toe fitness. If I were to have let this go, okay, I'm heading down a risk for hypertension, type 2 diabetes, because my glucose was borderline. I was a borderline pre-diabetic. My cholesterol was high, for those that, kind of are familiar with some lab work. So I was heading down that bad metabolic problem. The last thing I wanted to do was convert to type 2 diabetes. Breathing through the mouth puts you at risk for these things as you start to head down. And particularly if you have obstructive sleep apnea, these put you at risk for stroke, hypertension, type 2 diabetes. And the reason is because you never enter the rest and digest stage of sleep, right? The deep, deep, deep sleep, right? It's called rest and digest. You're in a constant sympathetic mode where you're turned on all the time. Your cortisol levels get high. You can see that show up sometimes in a thick, hunched area within the upper back where you get this thick tissue. So those are some signs of cortisol, or a super puffy face. Cortisol, you never get a chance to really relax in a chronic sympathetic type of state. So breathing through the nose, again, the nitric oxide helps you to vasodilate, deep breather into the lungs. Oxygen exchange increases tremendously when you do that, and allows you to enter that rest and digest. So you really need, again, homeostasis, equilibrium, harmony at every aspect of health strives for that. It doesn't matter what body system you're in, whether it's a
Mhm.
cardiovascular system, it, every single body system that we study is striving toward equilibrium, homeostasis, harmony, whatever you want to call it. So for me, aging, I want to live my best life. I want to have fun. I want to do stuff with my kids. if I have grandkids, I want to be around, I want to be strong, I'm going to pick them up, carry them. Those are my personal goals. And from the aesthetic standpoint, I want to feel that I look okay too. You know
Yeah.
what I mean? Like my husband says, okay, he thinks his wife is still attractive, right? Even when we're 80. So I don't think there's any shame in saying that either.
No.
You know what I mean? That people want to feel, and really what it is, Delaney, it's almost, you could say that you want to project what you feel on the inside, right?
Mm-hmm.
I think that's fair. I think most people at any age, want to project what they feel on the inside. If you're a very positive, upbeat person, you want to be able to project that externally. And sometimes aging process can take its toll on you. And so these are the things that we're talking about are some great things that you can do. And I think finding fun communities like what you've created, I think is fantastic. I love what you're doing,
Thank you.
building these types of communities. I want to be part of these types of communities. You know, my daughter, she's a sophomore in high school right now, and I have another son that's in college. And so I love all the young people, all the boys, they come over to my house and I love to hear about how they're doing. And they go to the gym and they take older boys, take my younger son to the gym. And I love that. I love that there's a camaraderie and a positive energy of going to the gym, not playing video games,
Mm-hmm.
not doing these types of things. They want to, and they're interested in cooking healthy foods. My son is so cute. He loves to cook off of this Le Creuset cookware. And so I
Yeah.
said, he makes the best eggs, the best scrambled eggs he makes. And so, and I love it. He's eating avocado and he's eating healthy. And I love that. So I want to be part of that, right? That
Mm-hmm.
part, as we get up there, same with your mom, right? You guys want to do your stuff. You want to, have fun and do stuff. So that's part of why I love talking about this area. I love talking about preventative health. I love talking about maintaining the highest quality of life that you can from a mental health perspective, finding your communities that are very supportive and positive. I love all of that. I can't get enough of it. It just, you get off a call like this and you're just like, let's go run 10 miles.
I love
Yeah,
that.
right? Let's
Yeah,
go. Let's go. Let's go. Let's go skiing. Let's go do something fun. you know, that's how,
absolutely.
and that's so I love all that because I've come from a place where I've seen the worst of the worst. You know what I mean? I've seen, bad outcomes with patients and I've seen some great outcomes, but I've seen a lot of bad outcomes. And sometimes when I read the chart, I think, gosh, if they had made different choices, but maybe they didn't know, they didn't have
Mhm.
the education. And a lot of people don't know.
Yeah,
You don't know what you don't know. And that's
right.
a common thing. You don't know what you don't know. But this is why we're doing what we're doing. And it's
Absolutely.
a blast. It's just such a blast. I love it.
Yeah, I love that, and it's so important, like, what you're doing is educating people preventatively so that they can know and that they can make the best choices. So with that, where can people find you and shop you? You guys, I'll make sure to put a discount code and link in the show notes, but where can people find you on social media and online?
Absolutely. So they can follow along at Your Triangle of Youth, and I named it after the tool, Your Triangle of Youth. I added the your in front of it. Then the website is beautyballoon.com. So just like it sounds, beautyballoon.com is where they can make the purchase, but you certainly want to purchase through Delaney's link to get the discount and sign up for the newsletter. And we'll do more educational topics across every aspect from the health area and from the aesthetic area as well. So lots of fun topics. And I would encourage anybody that wants more information, reach out to me too. And we'll do some of the fun sessions of exercising together so you stay motivated. And I want people to stay motivated and, like I said, incorporate a little bit of this every day so they can have the healthiest head and neck area and they can stay out of the ENT's office and stay out of the gastroenterologist's office and never end up in a sleep medicine specialist. Sorry, guys, my colleagues, sorry. But it's just one of those, and I'm saying that in a positive way. So I don't want to have any of those issues.
Yeah.
So we want to live as healthy a life as we can. So
Absolutely.
absolutely.
Yeah, so guys, I will put my link in the show notes, like I said, and my code is Delaney10. It'll automatically apply if you go through my link, but that is the code for 10% off of beauty balloons. I personally have been using them and will continue to do so. So make sure that you head to either of our Instagrams. We're going to be doing lives together to demo some of the exercises you can do to make it a little bit easier, especially if you are a
Mhm.
visual learner. I know I've really loved doing the exercises together because I'm learning all the tips and tricks to get the most out of my exercises. Dr. Catherine Kennedy, thank you so
Fun.
much for joining me today. That was so much fun.
I know, and it's so fun because it's a positive topic.
It
I
really
know,
is.
right? I know.
I love it. Well, you guys,
Thank
thank you
you,
so much for
Delaney.
listening. I hope you have a wonderful rest of your day, and we will chat soon.